a lot of calls or inquiries have come into our office between emails, between website inquiry about patients that, first of all, last week alone, we've got 3 people that have gone to Turkey and got some work done, and they're coming in for their evaluation because the poor outcome, again, Botched episode from Turkey and overseas. We'll talk about that another one. But here, this particular one is here. If you look at, this is big box, one of the big box implant centers locally. Corporate. Now, this patient really took upon themselves to go there. You can see the upper all on 4, lower all on 4. This was literally done maybe between 3 or 5 years ago. We see there's no zirconia teeth. We see like titanium bar, but look at the implant on the upper right. Instead of it's angled like this, it should be angled like this, away from the sinus. The other one is kind of there, but front 2 teeth implants, complete blowout bone loss. Look at the tooth on the bottom, implants on the bottom, complete bone loss. This is a very difficult situation, and we have to revise this case. Now, again, this went to a big box corporate clinic. That doctor, unfortunately, is no longer there. That doctor has moved on. This is what you will see. This is the downside when you go to a corporate big box implant centers. Patient is going to be needing Zygomatic implants, some remote anchorage implants, cleaning up a lot of the infection, and then we're going to be placing implants in simultaneously or in stages to give her the best outcome for a nice set of beautiful teeth eventually when she heals zirconia. We'll show clinically what the gum tissue looks like in the next slide, what the failing implants look like on the gums. So here is in the oral evaluation, we could see that implant on the bottom, what we showed on the scan that was failing. You can see a lot of gum loss. You can see a lot of inflammation around, and just the design of the prosthesis does not allow the patient to clean, and there's a lot of buildup and a lot of infection. So then the front 2 implants on the bottom will have to be removed. We put the patients on a mouth rinse, put patient on antibiotics before her surgery. Her surgery is scheduled here in the next couple of weeks while we get all the record and get everything ready for her surgery. Now we're going to show the top where the failing implants are and what the tissue looks like. So you can clearly see on the upper, you can see the upper gum tissue is really red, really puffy, and that failing implant on the upper left side, you can just see that really red, fiery gum tissue. So again, these are acrylic teeth, and the downside of acrylic teeth is they're going to build a lot of plaque, and they're not going to be self-cleansable like zirconia. So, we just want to talk about, we want to help this patient. The patient came to us, we'll say, here's what we could do. We're going to give her a good outcome, and then we're going to share what overall how her experience was, and getting her back to normal, a predictable solution, a solution, longevity, predictability, function, durability, and more like a lifetime value, so she feels like she's whole again, she's happy again, and she's restored again.